The treatment landscape in lung cancer, as in many tumours at the moment, is really dominated in some respects by immunotherapy. So in contrast to what I was talking about at this meeting, focusing on targeted therapies in tumours driven by a dominant genetic event like EGFR mutation or MET skipping mutation, for example. These are the sorts of therapies which seem, with the data available, to be most effective against the cancers which are more common, certainly in the lung clinic, that is the genetically chaotic tumours that we quite often see in smokers. And at this meeting, as in every other cancer meeting in the last few years, a lot of the discussion has been dominated by these immunotherapies. So, for example, we had a nice talk yesterday from Fred Hirsch, who's the Chief Executive of the International Association for the Study of Lung Cancer, who's a great supporter of BTOG and has been here many times. He gave us an overview yesterday of some of the clinical data, and particularly, given his interest as a pathologist, a focus on the biomarkers and some of the problems with detecting PD-L1, one of the targets of these checkpoint inhibitors, of course, and so the deficiencies of patient selection using only that as a biomarker. So we seem to be moving now inexorably towards perhaps a slightly more complex biomarker or group of biomarkers, and in particular we were discussing yesterday the tumor mutational burden, which gives us an idea of how many neoantigens might be present in a lung cancer, and that in turn is probably a surrogate for how effective these drugs are likely to be. So that in turn means that we need to think about how we measure tumor mutational burden, and that's probably not trivial outside of a trial setting. So whole genome sequencing or whole exome sequencing to measure TMB, as we're coming to call it for short, is probably not practical in the everyday clinic. So can we use, for example, a molecular genomic profile of a limited number of genes as a surrogate for the whole genome or whole exome sequencing, which in turn is a surrogate for the actual mutational burden in the tumour? That remains to be seen, and we'll have to see in future trials.